Welcome back to the AI Nurse, your go-to channel for exploring how artificial intelligence is transforming healthcare. I'm your host, and today we're diving into a fascinating topic: what nursing will look like in 2030 with AI. If you're a nurse, a student, or just curious about the future of medicine, buckle up. By 2030, AI isn't just a tool. It's a game changer that's reshaping every aspect of nursing, from patient care to daily workflows. We'll explore the innovations, the challenges, and what it all means for the heroes and scrubs. Let's get started. First, let's set the stage by looking at where nursing stands today, in 2025. The healthcare industry is facing unprecedented challenges. According to the World Health Organization, there's already a global shortage of healthcare workers, projected to reach 10 million by 2030. Nurses are at the forefront of this crisis. Burnout rates are skyrocketing, with many leaving the profession due to overwhelming workloads, administrative burdens, and the emotional toll of patient care. In the US alone, nursing turnover is hovering around 20–30% in some regions, exacerbated by aging populations and rising chronic diseases like diabetes and heart conditions. But here's the silver lining: AI is stepping in as a powerful ally. By 2030, experts predict that AI will automate up to 30% of routine nursing tasks, freeing up time for what nurses do best: providing compassionate, human-centered care. Think about it. No more drowning in paperwork or constantly checking vital signs manually. Instead, AI handles the grunt work, allowing nurses to focus on building relationships with patients and making critical decisions. Let's break this down into key areas, starting with patient monitoring and diagnostics. Right now, nurses spend hours monitoring patients' vital signs, charting data, and spotting early warning signs of deterioration. By 2030, wearable devices and AI-powered sensors will revolutionize this. Imagine smart beds equipped with AI that detect subtle changes in a patient's breathing, heart rate, or even posture, alerting nurses instantly via a wearable device or hospital app. Companies like NVIDIA and Foxconn are already developing nursing robots, like the Neurobot, which can patrol wards, take vitals, and even assist with mobility. Early trials show these bots reducing daily nursing workloads by 20–30%. In intensive care units, AI algorithms will predict sepsis or cardiac events hours before they happen, using machine learning trained on millions of patient records. This isn't sci-fi, it's happening. Predictive analytics from AI could cut hospital mortality rates by up to 20%, according to studies from McKinsey and the World Economic Forum. But it's not just about hardware. Virtual nursing is exploding. By 2030, remote AI-assisted monitoring will be standard. Picture a nurse in a central hub overseeing dozens of patients across multiple hospitals via high-definition video and real-time data feeds. AI will triage alerts, flagging only the most urgent ones, so nurses aren't overwhelmed. For home care, AI companions, think advanced versions of today's smart assistants, will remind elderly patients to take meds, monitor their activity, and even detect falls using computer vision. This could reduce hospital readmissions by 15–25%, easing the strain on acute care facilities. Next up, diagnostics and decision-making. Nurses often act as the first line of assessment, but AI will supercharge this. By 2030, AI diagnostic tools will analyze symptoms, lab results, and imaging with superhuman accuracy. For instance, AI-powered apps could scan a wound photo uploaded from a nurse's tablet and suggest the best treatment protocol, drawing from global databases. In oncology nursing, AI will personalize chemotherapy plans by predicting how patients respond based on genetic data. A study from the University of Pennsylvania highlights how AI is already assisting in early cancer detection, and by 2030, this could be routine, potentially increasing survival rates. Nurses will collaborate with AI co-pilots, think chatbots integrated into electronic health records, EHRs, that suggest evidence-based interventions in real time. Forgot a drug interaction? AI flags it instantly. Dealing with a rare condition? AI pulls up the latest research from PubMed or similar sources, tailored to the patient's profile. This doesn't replace nurses' expertise, it enhances it. As one expert put it, AI handles the what and how, while nurses provide the why and the empathy. Administrative tasks are another pain point for nurses. Charting, scheduling, and compliance paperwork eat up nearly 40% of their time today. By 2030, AI will obliterate this. Natural language processing, NLP, will transcribe doctor-nurse handoffs automatically, generating accurate notes from voice recordings. Predictive scheduling AI will optimize shifts based on patient acuity and staff availability, reducing overtime and burnout. Imagine an AI system that autofills forms, verifies insurance in seconds, and even generates discharge summaries. According to Incredible Health, automated processes could free up nurses for 10 to 15 more hours of direct patient care per week. Let's dive deeper into patient monitoring. Today, in 2025, continuous monitoring is mostly limited to high-acuity areas like ICUs. But by 2030, AI will make it ubiquitous. Wearable patches, like those from companies developing biosensors, will track glucose, oxygen levels, and even stress hormones non-invasively. These devices feed data into AI platforms that use machine learning to establish baselines for each patient. If deviations occur, say a spike in inflammation markers, the AI notifies the nurse with a prioritized alert. Patient in room 5, showing early signs of infection. Recommend blood culture. This proactive approach could prevent complications, reducing length of stay by days. Robots like Neurobot aren't just gimmicks. They're equipped with NVIDIA's AI chips for natural language interaction. A nurse could say, "Neurobot, check vitals on bed 3, and it responds verbally while updating the EHR. In long-term care facilities, these robots could handle nighttime rounds, allowing human nurses to rest. Trials in Taiwan show they're already cutting workload significantly, and by 2030, costs will drop, making them accessible even in rural hospitals. Still on diagnostics, AI's strength is pattern recognition. For nurses in emergency departments, AI triage systems will assess patients faster than ever. Using cameras and sensors, AI could evaluate pain levels from facial expressions or gait analysis for injuries. Integrated with EHRs, it suggests differential diagnoses. For example, in pediatrics, AI could flag subtle signs of abuse or neglect that a busy nurse might miss. Studies from PMC indicate AI is changing how nurses spend time, shifting from data collection to interpretation. In mental health nursing, AI chatbots will provide initial screenings for depression or anxiety, using conversational AI to ask questions and score responses. Nurses then step in for deeper interventions. This could address the mental health crisis, where wait times are months long today. Administrative relief is crucial for retention. Natural language processing, NLP tools, evolving from today's voice assistants, will listen to shift reports and auto-generate summaries, flagging inconsistencies. AI scheduling will predict surges, like flu season, and adjust staffing dynamically. For compliance, AI audits charts in real time, ensuring nothing falls through the cracks. This could slash error rates by 50% per industry reports. In research, nurses will use AI to analyze outcomes, driving evidence-based practice. AI tutors will use gamification, virtual patients that react realistically to decisions. Nursing schools will use virtual reality, VR simulations, powered by AI, to train students on complex procedures without risking real patients. By 2030, adaptive learning platforms will personalize curricula. If a student struggles with pharmacology, AI drills them until mastery. For practicing nurses, AI-driven continuing education will recommend modules based on their career goals and emerging trends, like handling AI ethics or new robotic tools. Of course, this future isn't without challenges. Bias in AI is real. If trained on urban data, it might underperform in rural settings. Nurses must advocate for diverse datasets. Emotionally, some patients might resist AI, preferring human interaction, so nurses will bridge that gap. Ethical considerations are also huge. Who's responsible if an AI prediction is wrong? Nurses will need training in AI literacy to oversee these systems, ensuring bias doesn't creep in. AI trained on skewed data could disadvantage minority patients. Privacy is another issue. With all that data flowing, robust cybersecurity will be essential to protect sensitive health info. There's also the fear of job loss, but let's debunk that. Predictions from McKinsey suggest that while AI will shift roles, it won't replace nurses. In fact, 90% of nursing tasks will still be human-led by 2030. Job shifts mean reskilling. Governments should fund programs. AI creates new jobs, like AI nurse specialists who maintain and optimize these systems. New roles like AI nurse coordinator will emerge, overseeing tech integration. The human touch, comforting a scared child, holding a dying patient's hand, that's irreplaceable. AI augments, not supplants. Globally, AI could help bridge shortages. In developing countries where nurse-to-patient ratios are dire, affordable AI tools like mobile diagnostic apps could empower community health workers. By 2030, the WHO estimates AI could help fill gaps in 4.5 million nursing positions worldwide through robots and telehealth. Looking ahead to 2030, nursing will be more efficient, patient-centered, and innovative. Hospitals will resemble smart ecosystems, with AI seamlessly integrated. Nurses will spend less time on tedium and more on healing. But success depends on collaboration. Policymakers must invest in AI education for nurses, and tech developers need nurse input to build practical tools. There you have it, folks. What nursing might look like in 2030 with AI, exciting times ahead. If you enjoyed this, hit that like button, subscribe to the AI Nurse for more insights, and drop a comment. Do you think AI will make nursing better or more complicated? Thanks for watching, and remember, the future of healthcare is bright, with a little help from AI.